A patient recently asked me something that stopped me. He said, "Doctor, why does it feel like nobody has time anymore?" They weren't talking about me personally. They were describing the system. And that question explains why so many doctors are quietly leaving clinical medicine. Medicine today is no longer organized around judgment. It's organized around speed, volume, and documentation. Doctor did not suddenly lose empathy. The system changed what medicine is allowed to look like. And the data backs this up. Listen up. About 1 in 3 physicians are considering leaving clinical medicine or cutting back. Among surgeons, nearly one in 4, are thinking about leaving within the next 2 years. Depending on specialty, 45 to 60% meet criteria for burnout, and burnout is pushing doctors to retire almost 5 years earlier than planned. This isn't happening at the end of careers. It's happening most in mid-career doctors. Not because they can't work harder, but because the system no longer lets them work better. And here's the truth most people don't hear. Doctors are not quitting patients. They are leaving systems that no longer allows them thoughtful, honest care. Many doctors could actually earn more by staying. They leave because income now tied to throughput, not thinking. One of the most damaging changes in medicine is hyper-documentation. Doctors no longer document to improve care. They document to satisfy insurance, justify billing, and protect themselves legally. So a visit that takes 10 minutes of real medicine often requires 30 to 40 minutes of clicking afterward. That documentation does not improve quality. It steals time from listening. At the same time, reimbursement keeps falling. Doctors are running high-risk businesses. Student loans, malpractice, staff salaries, rent, software, compliance. When reimbursement drops, the only way to survive is volume. More patient, shorter visits, less thinking. That's not moral failure. That's simply math. Documentation also isn't just about billing. It's legal armor. Because if something goes wrong, the question becomes, can you prove everything thought you had? Doctor over-document, not to improve care, but to survive litigation. Meanwhile, decision-making has moved upward. Doctors are expected to execute protocols and efficiency targets. While still being held responsible for outcome they did not fully control. That's not the medicine we were trained to practice. And a culture shift on top of this. Patients struggle to accept that complications are real. When we say 5% risk, it means 5 out of 100 per patient will have that complication, not 0, not never. And that pressure, combined with volume, documentation, and legal exposure is crashing. So patients feel this is a rushed visit and lost relationships. Doctors feel it has a moral injury. Here's a self-check for patient. If your doctor can't explain why something is urgent or why it can safely wait, that's a system constraint showing. At the end of the day, many doctors ask, am I still practicing medicine or just surviving it? That's why doctors are leaving. This is not a future problem. It's already happening. Quietly, steadily, system-wide, and it is not irreversible. Some physicians, like us, are rebuilding slower, patient-centered models, and patients are starting to seek them out. This is Dr. Ben Marmer. Follow to help build momentum to fix healthcare in America. And let me know what you think. Your feedback will sharpen the message.